Hi, my name's Scott McGann with the Falmouth Health Department, doing our weekly Friday COVID update. Today is September 4th, 2020. You can reach us at 495-7485. Our email is health@falmouthma.gov, and you can go to the falmouthmass.us for COVID links and information, and actually this presentation as well. Starting as of today, we have 247 cases of COVID-19 since the beginning, our first case being March 19th, and these are PCR or molecular tests which detect viral DNA, so that's what that number is, confirmed cases. There's been 6 confirmed cases during this week from August 28th till September 4th, both locally and out of area acquired, meaning I do get a lot of questions about where the number comes from and whether we're exporting cases during the summer because people are here on vacation and go home and they get contact traced in the town at which they reside. And the reverse is true if somebody is out of town and get it, but their address is here. So we have a few of these that are both locally obtained and out of area acquired out of the 6. Over 97% of total cases are no longer in isolation. Falmouth's about 15% of all cases, by the math in our population, about 14 is expected. So we've had a bit of a jump this week with a few local and a few out of area acquired. If you look at our weekly case trend, we had 0 last week. I think we had 2 or 3 the week before. We're in that sort of, we're at 6 or so this week. The numbers have been averaging since mid-June in that under 10 per week range, with the exception of 1 week with lifeguards, and actually that was the LongTerm Care facility that we had multiple cases in around the same week. Again, our highest was almost 40 in a week. That was back in April. So, that's where we're at for this particular week. It wasn't definitely not as good as last week. From the beginning, our cases are right now fastly approaching 250. We were at a pace where we hit 100 by early April. So we hit 100 by early April, and to get to 200 took us till July, and to go from early July. And it's been 2 months to get to 250. So, that's a better trend than what we were seeing earlier on. So that's kind of where our numbers are in terms of Falmouth. The state weekly updates, you can get that from the from the state of mass.gov DPH website, is they do every Wednesday afternoon. They do an update of the chart based on, each town and or city and how they're making out. We remained in the gray. We were probably pretty close to the green. The state grabs the data. They grabbed it at 246, which kept us at 5 cases or less. And that's where we're at, that sort of gray number, gray color. Again, this is going to be used when the school's open. I'll be talking about that in the next slide. Where the cases come from, if they're congregate care. If we happen to get 4 cases during the week, that puts us into the yellow, but the 4 cases were all from others out of state. Because, for example, if somebody uses, this was actually on a call today with the state. We have twice a week calls with DPH that, some of the towns were like, we were in the yellow, but a lot of our cases were from travel elsewhere. And so the state tells you to take that into consideration when you're deciding what you want to do with schools and so forth. Because it's not a perfect system, and the system is tracked based on the address that the person puts on when they have the test taken. And so that's why it goes as that way. And we do the contact tracing. For example, one of them this week, there was no relation to that particular address. The test was taken about 1,500 miles away. There was no relation that we can tell. So those types of things do happen. Somebody gets a test in, Minnesota, and it somehow pings on our cases, and we work those things through. And sometimes cases come off, and so forth. But right now we're still in the gray. If you look at, I have the last 3 weeks for Falmouth individually. On 8/20, we had 241. 8/27, we remained at 241. 9/2, we're at 246. Yesterday, we made us to 247. Our average daily incidence rate was 1. It was 0.5. We had a good week with the 0. And it went up to 0.9 with the few cases that we got this week. And we probably would have been in the green if the Thursday case came in on a Wednesday or whenever they happen to pull the data for this particular, what they do on their Wednesday night. So again, we went higher. Obviously, we had a few cases, so we're in a higher trend than having 0. Our testing is still robust. That was 1,435 tests in the last 14 days, which is higher than what we had earlier in August. So our trend is upward, 5 positives. Our percent positivity is 0.35, which is still a good number. That's 3.5 positive tests per 1,000 tests taken, which is a low positivity rate. If you look at Barnstable County for this week, they're at a 1.6 per 100,000, so we're lower than that. There was total tests in the county of almost 7,500 count, with 52 positives at a 0.69. So our percent positivity is still better than the county because we're doing a lot of testing, which is good. Now, statewide, the positivity is 4 positives per 100,000. They're doing a lot of testing. We'll talk about in a second. Their percent positivity for the state of all is just slightly above 1%. So the county's doing better, and than the state is what to say. Again, these metrics are going to be used when we talk about the schools remaining open or going to remote, and it's also going to matter not just the color, the cases, and where they happen cases come from is also important. If you look at testing by town, we're doing fairly better. We're pretty good on our testing rate. Like I said before, that's a lot of tests. I think 700 tests a week are good. Or better, a lot better than what it was in the spring. And our percent positivity is looking pretty good in terms of the rest of the state. So the lighter color is what you want on the right column, the darker color is what you want in the left-hand slide. So you don't want that to be flipped. As far as Barnstable County, you can see that back early on in that March, April, May, we were averaging like 30, 40 tests positives a day. We got down really low in the June area, where 1s, 2s, 3s, and 5s. We picked up a bit at mid to late July into early August. We were doing teens and 20s sometimes, mixed in with some low digits. In the mid to late August, we're back in that 1, 0, and 2, and then you can see that we've had an uptick. Now there was a couple of incidents that you saw maybe on the news. Steamship Authority did some testing, and probably some other issues that are happening in other towns as well. That brought that number up to the 12. I think yesterday it would be 10. So you want, the double digits kind of crept back in. We need to get that back down into that 1, 2s, and 3s for the county. So the county's had a total of confirmed and probable total of 1,886. This is of 9/2. Another slide will show it more recent with 166 deaths. Barnstable County had 10 positives reported on 9/3 with a total of confirmed cases. This is to be the molecular, 1,645. The state dashboard, again, this is updated daily at 4 o'clock, around there. We did 31,000 daily tests, 31,584, with 393 positives. That number goes obviously up. 31,000, I think, is the biggest number I've seen at looking at these every day. We've had 17 deaths reported this day, with a total death since the beginning, total number of deaths of 8,870, and total number of confirmed cases just slightly under 120,000. Our progress hasn't changed in a couple of months now that we're doing well. We're in positive trend on the measurements that we use. With death being in progress, it hasn't dropped down into green yet. We need to get that down to green. And healthcare readiness is a little bit above my pay grade. I don't know exactly what they use for metric on that. But some of these, the contact tracing capabilities, our testing capability, positive test rate are all in the green, and those are important numbers. As far as the trends, state trends, our percent positivity is still on a downward trend, which I told you is very important. I've been telling you all along. So it's real important that we want to keep the percent positivity down. Hospitalizations have been sort of flat around that 300 range. It was up a little bit in late August. But since I would say mid-August, we were around 400. We're down in around low 300s, which is a good trend. Surge capacity does fluctuate based on what the hospital has for needs and so forth. And our deaths have been staying in the teens, and we have not been able to get out of the teens. I think that's one of the things that we really need to get better. I know the hospitals have gotten better with treatment. And I'll talk about local hospitals in a second. We can talk about it right now. Cape Cod Hospital has 1. If you see, Falmouth Hospital's been 0. They had 1 hospitalized, I think, a couple weeks ago. None in the ICU for a while. So if there's a silver lining that at least in Falmouth and in Cape Cod that the ICU stays in ICU and hospitalizations have been down all summer long. And that's a great sign. So it's maybe a treatment. Some of it might be lower demographic, younger kids getting it per se, but also, it could be a factor of the fact that we're doing social distancing and mask wearing, and the initial viral load that people get if they do get it, is at a lower rate than if we were not wearing masks and we were close together and the viral load to start. Because obviously, the less virus you start with, the better chance you have of having a milder disease. In terms of hospitalization, we're still down. We're down to 312. I think we were 333 last week. We're down about 500 from June of daily hospitalizations, and down from early August of 89 from hospitalizations. Current cases in the ICU is down 24 from August and down 135 from late June. That's down to 61. And currently cases intubated, we've had a little bit of uptick in intubations from the 21st to the 26th. This could be a single long-term care facility. It could be something of that nature. Not really related to Falmouth, but we're down 82 from June 26th and down 10 from August 7th. We remain unchanged in our long-term care facilities. The case counts remain the same. No active cases going on there, which is great. And if you look at the state, we still, statewide, about 65 to 66. It's been pretty consistent for a few months now of all deaths associated with long-term care. So that's it for the metrics. As far as COVID-19 testing, again, same places, Falmouth Hospital. You could also do it at Cape Cod Hospital. Your physician will have to schedule that by appointment, calling the call center at 862-5595. You can also get it at the East Falmouth CVS, walk-in clinics such as Convenient MD, the Community Health Center of Cape Cod, Mashpee. And as things arise on this, we'll update you on weekly. And this is for the molecular test, the one that would be considered confirmed. The only place currently doing antigen that I'm aware of is the Caremark in Dennis. And I'll talk about different types of tests in a second. Go on, if you want to check the Mass website, you can go on, you can just Google COVID testing in Massachusetts, and that website will come up, and then you can just find your test center. Again, antibody tests are considered, actually, I should change that, it's considered suspect. They just changed that. It detects antibodies in the blood, and it really indicates a past infection. The antigen testing is very rapid, which is really cool. But it's not nearly as accurate as PCR, and it's considered a probable, not a confirmed case. And it detects antigens that are actively fighting an infection. But other types of illnesses and so forth can trigger this antigen to show up, so its accuracy isn't quite there at this point. PCR, or viral, molecular is also called, is actually detecting the viral RNA or DNA, but I think it's RNA is probably a better term. It does take a little bit of time because it does have to go out to a laboratory to run the test. It takes greater than 24 hours to several days. The state is, last time they said something, they said that it was about 75% of all tests come back in 72 hours or less. But that's the gold standard, which tells you that you have an active infection or very recent infection. It's very sensitive, and that's why at the beginning we used to have a negative test in order to come out of isolation. We stopped doing that because you can shed dead viral RNA for quite some time. It's a very sensitive test. It's the only one that the Mass Department of Public Health considers a confirmed case. Flu shots. I want to talk a little bit about flu shots today. One of the benefits of doing social distancing and mask wearing is it's going to work for the flu just like it works with COVID. I mean, they're both viruses that transmit through the air and through droplets. So that flu shot, I would think that flu cases should be on the lower end this year. It should go down as a result of us continuing to do the same things for COVID that would work for the flu. However, the flu will complicate things in terms of having similar symptoms. So flu clinics and demand for flu shots are going to be high this year. The first set flu clinic is September 26th from 8 to 12. That's going to be at the Barnstable County Complex on 6A in Barnstable Village near the courthouse. It's going to be offering the quad vaccine, which has all four of them, quadrivalent. It'll be for over the age of 6 months. They'll have high-dose flu vaccine available for ages 65 and over, and the state vaccine is available for the uninsured. This is a mass drive-through clinic. I'll be there. It's all the towns are participating, and we're doing it as a big group. So that is the first clinic. And so if you want to get your shots and you don't have access to your physician and you want a shot in September, that would be the place to go. It's going to be well-run. I'm sure it's going to be a drive-through. Barnstable County is really good at drive-through. They were doing the drive-in COVID testing all along, so I think they've got that hammered down. As far as Falmouth, I'm working on getting a flu clinic for a tentative date of October 26th with the location to be determined, trying to work on a drive-through with details to follow. And one of the reasons is that with the demand of flu shots, it's, they're trickling in. They're not necessarily coming in large quantities to everybody. So I want to make sure I have enough flu shots and I have enough nurses lined up to do it. A lot of the same nurses that do contact tracing also do the clinics. So they're at a, it's at a, there's a demand. So the dates, we're trying to separate dates so we don't have other towns doing it on the same date and stressing the resources of the VNA. There's also the MRC, which is the Medical Reserve Corps, which we're going to be using, which is volunteer nurses and healthcare workers that can issue shots. So we're working on one, and it's a tentative date of October 26th. Again, also your local pharmacies, your physician, your pediatrician would still be getting the flu shots if that's how you normally get it. You just want to make sure that they have it, so you want to call your physician or your pediatrician to make sure that they will. So that's not going to change either. I just want to make it more available for everybody. Also, it's required for attending in-person school, and so, working on getting some additional doses that we can use for children, especially those that are uninsured. So I'm working on obtaining that through the VNA, and so more to be coming, and I'll be posting that on our website, and then when I do these weekly, I'll also add that onto there. So just start thinking about getting your flu shot. So if you have kids in school, you're going to need it. There is an exemption, medical, religious type of exemptions that you can do. There are some of those. And if you're over 65, if you can't make this clinic on the 26th and you can't get to your pharmacy or your physician, we're working on getting a clinic set up as well. But if you can make that one on September 26th, it'll be a drive-through. It'll be really good. And if you're over 65, they do have the high-dose flu vaccine. Next thing we'll talk about is on the 14th, there'll be town meeting. This one will be inside at the high school. There's a map that's a tentative draft map of where all the seating arrangements will be utilizing, in proper spacing, flowing traffic in and trying to keep choke points at a minimum. So there is a town meeting coming up in a couple of weeks. And so that is the map, and each one of those little rectangles indicates a chair. So we will have spacing for it. So that's just talk about town meeting. If you're a town meeting member, for details you can call the town manager's office or the town moderator. If you have health questions, you can also call us as well. Social distancing and face coverings. Obviously, the last thing we want to do is do the hard work, especially with school opening. So again, continue diligence with the social distance and face coverings, hand washing, hand sanitizing. Quarantining upon arrival from location with higher rates. I think the last time I checked to see how many have done that, I think we've had about 1,500 to 1,700 quarantine upon arrival forms filled out for Falmouth. Avoid gatherings, parties, and indoors without social distancing. Stay home when ill. If you have a business or something that or deals with the public, and you have state guidance for your particular sector, you want to follow those. We continue to follow up at the health department on all complaints. And mandatory face coverings were put in a few weeks ago on Main Street and again in Woods Hole at the Water Street, Luscombe Railroad. So again, the social distancing and mask wearing is effective, not only for keeping the community spread from occurring. It also, I think, this is a personal note that I think that it does help with the amount of dose that you might receive, the viral load you might receive if there was somebody affected. That in an indoor confined space, you happen to be there, but with your mask and face coverings, that it does lessen. It's just my personal opinion. I think that it is effective because I have noticed over the last 3 months that the hospitalizations are definitely down in Falmouth. Our cases are down, but we do get cases, but they have not been appearing, at least recently, knock on wood, that there have been as severe, and maybe that's got to do with the distancing and the face coverings, and I like to think it does. So that's where we definitely, again, don't want to undo the hard work, especially going into our last busy tourist weekend of Labor Day. Just making sure that everybody's doing the right thing. Again, as a recap, the state metrics are flat. Falmouth's had an increase this week. Again, some of it being out of town, but some of it being in town. So it's something that we have to keep watch and do good contact tracing on. And our current level in Massachusetts remains at phase 3, step 1. So that's all I have for this week, and I'll see you guys next week. Thanks.